Now, in Zimbabwe, a government plan to criminalize recruitment of its health workers by other nations has been criticized by the country's doctors' associations. Now, the associations say authorities should focus on addressing the underlying problems affecting the health sector in Zimbabwe instead. With more details, here is CGTN's Farai Mwakutuya.
Zimbabwean health workers have downed their tools several times in recent years to press for higher pay. Despite the frequent protests, things haven't improved.
All they want is the brains, they don't care what we want as well, what we are supposed to get as doctors. The remuneration is very poor. They recently doubled salaries for other workers, but not for doctors. Yet they classify us as essential services.
That designation means health workers can be charged for going on strike under recently passed legislation, which has added to the collective anguish. The medical practitioners have been left frustrated by the lack of willingness to come to the negotiating table by the authorities. They say several requests for meetings to discuss their grievances have been ignored. Many health professionals, especially nurses, have resorted to leaving the country for higher paying jobs abroad. If you're doing the same job you're doing now in the diaspora, how much more would you be earning?
It will be 5 times more. It will be 5 times more than, with what we are earning right now.
When I asked him if he would leave the country too, the answer was emphatic.
Definitely. I would go, unless something changes.
The health minister recently said government may pass laws that make it illegal for other nations to hire local professionals.
Why there is the brain drain in the first place? I think that's the question they should be asking. Why are doctors leaving? If they can't afford to pay what they like, what we would like, and then that's what happens. People seek greener pastures. That's what happens. So they need to address that. They have to find a way.
Government has previously said it can't afford the wage demands and has offered several non-monetary incentives, including subsidized housing and transport. Farai Mwakutuya, CGTN, Harare, Zimbabwe.